Hi everyone, this is Mrs. Branson, and today I'm going to talk to you about infectious conditions in childhood. This is chapter 33, and we'll be going just through pages 964 through 973. Infectious conditions include the communicable diseases of childhood. We know that the communicable diseases of childhood have been major killers throughout the world and have actually shaped the history of the world because they've caused so much mortality in the past. But now the incidence has declined because of the miracle of immunizations, in addition to the discovery of antibiotics and antitoxins. What you're looking at on the screen today is a representation of the chickenpox virus, which we're going to talk more about in just a minute. One of the things that's very important for us to do when we're assessing a patient with a contagious disease is to identify the infectious agent. This is very important so that we can prevent the spreading of the disorder. We want to treat the patient and we want to stop the spread of a contagious disease. You may see this particular wordage in your book, prodromal symptoms. That just means the very beginning symptoms before the actual outbreak of lesions or classic symptoms of the disorder present. You also want to know the patient's immunization history, and you want to do a thorough head-to-toe assessment of your overt clinical symptoms. One of the most important things that we do is we stop the spread of disease. So remember that our primary prevention of the communicable diseases of childhood is through immunization. Unless a population has 85% of the susceptible hosts immunized, the entire population is at risk for communicable diseases. Another thing that we want to do is we want to use our other interventions to try to control the spread of disease, such as infection control practices, hand washing, basic hygiene, not sharing cups, dishes, those kind of things. We really want to stress hand washing to our families. We also want to prevent the complications of infectious diseases. For example, we want to recognize the groups that are very susceptible for the serious complications of communicable diseases. Now, once we start talking about each of these diseases, you will see that these children that are listed on this slide are the ones that are at the highest risk for the life-threatening complications. And the children that are at the highest risk include those that are taking steroids or are taking some other type of immunosuppressive therapy, children with generalized malignancies, children with immunological disorders, infants under the age of 1, and children with hemolytic diseases. These children are very susceptible to something like varicella zoster, just as an example. Now, what is particularly dangerous to this very susceptible group would include chickenpox, fifth disease, and herpes. And of course, the particular organism that causes chickenpox is varicella zoster. And we do have, even though this is a virus, we do have an antiviral that is effective against this organism, and that's a cyclophore or valacyclovir. And here is the rundown of the major communicable diseases of childhood. Chickenpox or varicella, caused by varicella zoster, diphtheria, fifth disease, roseola, and rubeola, which is measles. So now let's talk about chickenpox or varicella zoster. Okay, chickenpox is caused by the virus known as varicella zoster. It's spread by the secretions of the respiratory tract through airborne droplets and direct contact. Incubation is about 14 days. The person is infectious 2 days before the eruption of the red spots, and their contagiousness lasts for about a week. When someone has this disorder, we give supportive care, and we need to be very careful not to medicate with aspirin, because as you know, aspirin can cause Ray's syndrome. There's no medical treatment for chickenpox unless the child is high risk, and then we would use a cyclovir. The virus, once it gets in the body, lays dormant, and it lays along the nerve endings for the rest of that person's life. It may return in another way during adulthood, and we call that shingles. Now, why is chickenpox a killer? Because it can be the beginning of secondary bacterial infections. Varicella zoster can cause pneumonia, sepsis, and thrombocytopenia in impaired immunosuppressed children. This is a disease that, for the most part, is only going to occur in children under the age of 15 in the chickenpox manner. And we definitely want to protect our high-risk population from this infection. Just as a reminder, what is thrombocytopenia? If you've forgotten, it means that you have a significant decrease in your platelets, and therefore you would not be able to clot appropriately and would be at high risk for hemorrhage. Okay, the next disease that we're going to talk about is diphtheria. Diphtheria is spread by direct contact. It has an incubation period of 2 to 7 days. It may be infectious up to 2 to 4 weeks. The symptoms begin with the symptoms of a common cold, a low-grade fever. One thing that's unusual about diphtheria is that the patient has an unusually elevated pulse. As they get sicker and sicker, a membrane forms on their throat or tonsils. They have a hacking cough, and they have so much swelling in the throat area that they have the potential for airway obstruction and cyanosis. The lymph nodes swell profusely, and we call this profound swelling in the neck bull neck. As you can see in these illustrations, there's tremendous swelling in this young man's throat, and the membrane is exposed in the last picture on the page. That thick white thing that you're looking at down his throat is the diphtheria membrane. It can actually cause choking in some children. Now, why is this a killer? Because in some cases, the combination of the membrane and the tremendous swelling of the throat area can close off the airway and require an emergency tracheostomy for the person to be able to breathe. It's also had documented cases where after diphtheria, the child develops cardiomyopathy or toxic neuropathy. Another communicable disease of childhood is fifth disease. It's caused by the human parvovirus. It's common in school-aged children. The incubation period can be up to 2 weeks. It's not necessary to isolate the child unless this child is hospitalized. Children with hemolytic diseases are at risk for aplastic anemia from parvovirus. Aplastic anemia, as a reminder, is a condition that occurs when your body stops producing enough new blood cells. Aplastic anemia leaves you feeling fatigued and with a higher risk of infections and uncontrolled bleeding. Why is Fifth disease a killer? It can infect pregnant women with life-threatening effects to the unborn fetus. With children that are infected with Fifth disease, it can cause myocarditis. Roseola is something that a lot of us have seen. It is caused by the human hypervirus type 6 or 7. We have no idea what the incubation period is. We have no idea how long it's communicable. This particular infection occurs year-round. The symptoms are that the child presents with a persistent high fever for 3 to 4 days, and then the pink macules appear on the trunk and spread through the body, the face, and the extremities. There's severe lymphadenopathy. The high fever may cause febrile seizures, and it can also affect the CNS. So what are we going to do? We don't have anything to treat this with as far as medication. So we force fluids, IV fluids if necessary, and treat the fever. Why is this a killer? Because it can go on to cause encephalitis and myocarditis. Okay, our next disease is measles or rubeola. Measles are transmitted with direct droplets by the infected person, and this is a rare case where the urine is also positive for the microorganism and can be transmitted by contact with the urine. The person is infected 4 days before until 4 days after the rash occurs. The rash is going to appear about 4 days after the early symptoms. One of the things that we can do for children with measles is we can treat them with vitamin A supplements. A single dose of 2,000 units of vitamin A in children older than 12 months can reduce morbidity and mortality from measles. It can shorten the headache and vomiting. Let me repeat that. I said that wrong. It can cause a short-term headache and vomiting, but we're going to give it anyway because the benefit really outweighs the temporary negative side effects. So the symptoms of measles are anorexia, abdominal pain, malaise, photophobia, generalized lymphadenopathy. These children need to be isolated until the 4th day, and we need to use droplet and airborne precautions. Now, this traditionally is a disease that has had tremendous mortality associated with it throughout the centuries. Why is it a killer? Because it can cause encephalitis with very high mortality. Measles have killed millions of people throughout history. It is a very contagious disease. For example, most of Europeans had over the centuries developed some immunity to measles, so their mortality rate was not that high. But when explorers first landed on the Hawaiian Islands who were from Europe, they introduced measles to a population that had never been exposed before, and measles really burned through the Hawaiian population and just had extreme mortality. So that's what happens to a population that has no immunity, no natural immunity against a very contagious disease. Okay. Our next disease is mumps. is caused by the paramyxovirus. The organism is in the saliva of the infected person, and it's transmitted by direct or droplet transmission. It has a fairly long incubation period of 16 to 18 days. The person is definitely infectious before swelling of the parotid glands begin, and the parotid glands can swell on one side like this young man in the picture, or on both sides. So this is a patient that needs droplet and contact precautions. They need a soft diet that doesn't require chewing. The parotid glands are very tender and irritated, and chewing makes them hurt more. They may have a swelling in either the neck or the groin. If the groin swells in post-pubescent boys, then they have a high risk for sterility as an adult. It can also occasionally cause a hearing loss. So how are we going to treat it? We are going to give analgesia and IV fluids. Why are mumps a killer? Because they can cause post-infectious encephalitis, myocarditis, hepatitis, pancreatitis, and meningitis. We're going to now talk about some more diseases before we finish this particular section. I put these pictures up here for you to see. I believe the one at the bottom is a virus, and then the one at the top is a bacteria. They have very different ways of presenting under the microscope. Okay, now let's talk about rubella. Rubella is called German measles, or the 3-day measles. It's a contagious disorder caused by a viral infection, and it produces a very distinct red rash. Rubella is not the same as rubeola, although the two illnesses do share some characteristics, including the red rash. Rubella is caused by a different virus than measles, and it is neither as infectious nor as severe as measles. Now, here's some good news. Because of our efforts at immunization, the CDC has declared rubella eliminated from the United States. But one of the things we have to do to continue to enjoy relief from this disease is to keep our children immunized, and also to remember that we have a lot of immigrants coming to the United States from areas of the world where rubella is still prevalent. I also want to remind you that rubella is extremely dangerous to pregnant women, because if they if they catch rubella during pregnancy, it can cause really devastating birth effects to their unborn child. Now let's talk about scarlet fever. If you guys remember the novel Little Women, I believe it was Meg in the novel that had scarlet fever and eventually passed away. So hopefully you guys will understand that disorder a little better after this lecture. Scarlet fever is transmitted by direct contact or droplets. The person is infectious during incubation and the clinical illness. So what are the symptoms? An abrupt high fever, an elevated pulse, headache, vomiting. The throat is beefy red. So if you look at the pictures, we call this the strawberry tongue, and it can either be a red or white strawberry tongue, and the body has a pinhead size red rash. Now the skin where the rash is going to slough off, and it begins in about 3 weeks after infection, and we call it sandpaper skin because that's what it feels like, and it will just peel off and slough off, and it can be the body and also the hands, the palms of the hands and the soles of the feet. We do have something to treat this disease with because it's caused by group A strep, so we treat it with penicillin. And if we also want to use standard and droplet precautions until 24 hours after the antibiotic has started. Why is this particular disease a killer? Because it can cause acute It can start acute glomerulonephritis. It can attack the heart and cause rheumatic fever, which is what happened in the book Little Women, and it can also cause death by toxic shock. So let's just review rheumatic fever. Rheumatic fever is an inflammatory disease that develops as a complication of inadequately treated strep throat or scarlet fever. Rheumatic fever is most common in 5 to 15-year-old children. It can cause permanent damage to the heart, including damaged heart valves and heart failure. It can also cause painful and tender joints, and it can manifest itself by small, painless nodules underneath the skin. Okay, another very serious communicable disease of childhood is pertussis. Pertussis can be very mild in adults, but it's very serious in children. The child will present to have a cold or an upper respiratory tract infection for 2 weeks. It just doesn't seem to get better. And after about 2 weeks, a dry, hacking cough will start. Now, after the hacking cough, when the child inspires, takes a breath, that it makes a sound like a whoop. You won't hear the whoop with a baby under the age of 1, but you definitely hear it in older children. We can treat this with antibiotics. We treat with erythromycin, or zithromycin, or clarithromycin. We definitely want to use azithromycin for infants under the age of 1 month. Now, infants with whooping cough have trouble maintaining adequate oxygenation. They probably are going to need hospitalization, and they're going to need support with oxygen and fluids. Children under 6 months are going to end up in the intensive care unit, and many of them have to be put on ventilators. When we're caring for a child with pertussis in the hospital, we need to use droplet and standard precautions. We've seen a significant increase in the rate of pertussis in the last decade in infants under the age of 6 months and also in children between the ages of 10 and 14. Infants present with gagging, coughing, and vomiting, and also with periods of apnea. Remember, they do not whoop. Older children present with the classic intense coughing and then the sound of the whoop as they inspire. It can be brutal coughing that causes a lot of damage to the body. If you look at our little Hispanic boy at the bottom of the page, look at those conjunctival hemorrhage in the eye. It can also cause fractured ribs. The children cough so hard. It can cause bleeding into the lungs, pulmonary hemorrhage, and it can even cause rectums to prolapse because of the intense coughing. So I think I've already answered the question, but let me ask it. Why is this disease a killer? Because it profoundly affects the child's ability to oxygenate. It can cause a secondary pneumonia, and a lot of damage from the fierce nature of the coughing. That concludes this lecture. Good luck on your exam.